This is my iris hook I have designed few years back. I do have patent pending, and I do have financial interest. The hooks are modified from the existing hooks and designed by by myself and made and marketed by Madhu Industries, New Delhi. And this, do I have pointer? Can I have pointer, please? So these are the hooks. So from existing hook, we modified this angulation. It is something like capsule hooks, and it was not available in the market. So we designed, and it is available in this like pouch. And material used is 50 medical grade nylon fiber. It is quite lighter, quite thinner, very much malleable. And there are lots of differences between previous version and our designed hook. Previous version used to pull the iris out and up. That is a physiology, that is a physics. While our designed hook pulls iris only out, not up. And there is a big change. So iris tissue remains in the single plane parallel to the iris and in the same plane. So it will be dilated, it will not be pulled out. Thereby dilated pupils mechanically without damaging the sphincter pupillae. So after using this hook, if once we remove the hook, sphincter pupil remain practically normal. As per design, as iris tissue remains in single plane, AC depth is little more with compared to its previous version. So anterior chamber depth is more, naturally we get advantage of it. As there is no marginal damage to iris sphincter, pupil light reaction remains normal post-operatively. As iris remains non-tented, means it is not pulled upward, chances of iris prolapse from the side port or main port remains very minimal. As the AC depth is more, there are less chances of endothelial and posterior capsular damage and its related consequences. While inserting the IOL, sometimes leading haptic gets caught into the previous version iris hook, while in our hook it is really prevented. So these are some advantages, and this is the hook which is going inside, and there is a little difference in the technique. You have to hold from the angulation like here, and it goes inside the eye, and actually it is not much different than the previous version, but the advantages are obviously very different. So all the hooks can be placed like this. So this is our designed iris hook, and IOL is being injected. So see, many a times from here the leading haptic gets can damage the sphincter pupillae. So iris is not pulled upward, depth remains, anterior chamber depth remains wonderful, and the chances of sphincter damage during injection of the IOL is also reduced. And very simply we can remove the iris. This is 50 medical grade nylon, very much pliable, very soft. It can be easily removed from the eye post-operatively. And actually this all are the geometry and all these things we put for the patent, and during that period I describe all these things. And this is actual diagram how it pulls the iris out, not up. And almost no damage to the iris and sphincter pupillae, and iris is quite normal. And two other cases, and this video shows the pupil reaction, though it is minimal, but it remains intact by using this iris hook. So try it once. Cost is almost same as the routine iris hook. Madhu Industries and their dealer will help you to get these hooks. Thank you. Thank you for your.
Thank you, Dr. Dholakia. A wonderful innovation. And actually, this is a very good idea. This is like a capsular hook where the angle has been given. When the capsular hook,
Hook, yeah,
the
capsular
capsular
hook.
hooks were made with this angle only so that the capsule is not tinted upwards and tinted upwards.
Yeah.
So same modification has been done into the iris hook. So the iris is not tinted upwards.
Yeah,
So this is a very good idea to make. Thank you very much for wonderful designing of the iris hook. But in any case, if you do not have the availability of these iris hook, so when we make a side port incision for the phaco surgery, we make it corneal, because if you make it on the scleral on the conjunctiva gets ballooned up, conjunctival chemosis happens. But when you are putting the regular iris hook, not this modified one, then make the incision more posterior.
yeah,
Even if it bleeds, it doesn't matter, but then the iris will not be lifted upwards towards the cornea. Secondly, the two position of the iris hook which are closer to your phaco probe should be closer. I mean, make the openings like a trapezoid, because the maximum damage is done where the phaco probe keeps on going and rubbing the sphincter. So wonderful innovation, and we'll request you to use, and I've seen some of them. Thank
Okay.
you very much.
Okay, sir.